We're particularly interested in identifying risk factors for dementia, so things that increase the risk that we can modify with interventions. And there's been a particular interest in hearing impairment and whether that can increase the risk of dementia. We used the UK Biobank study, and our sample consisted of around 80,000 participants aged 60 plus. These participants undertook a test called speech and noise, and that measures the ability to pick out snippets of speech in a noisy environment. And what we did was look at whether those with poor speech and noise performance were more likely to develop dementia compared to those who had normal speech and noise performance. So the main finding of the study was that participants who had worse hearing had almost double the risk of developing dementia compared to those who had good hearing. And we also looked at whether this could have been driven by other factors, so whether social isolation or depression could have been underlying the association, but we found little evidence that this was the case. So it's important to bear in mind with this type of study design, you can't infer causality, but this adds to the existing literature that hearing impairment could be a modifiable target to reduce the risk of developing dementia. And in particular, speech and noise is an important component of hearing impairment that has been understudied in the past and might require particular focus when developing strategies for treatment and prevention.